Hey everybody, today I want to talk about an exercise called the deadlift. This can be a great exercise, but it's also an exercise that's commonly done incorrectly. When it's done incorrectly, it leads to injuries. As this exercise is becoming more popular, I am increasingly seeing those injuries, which is what made me want to make this video here. So what I want to do is I want to talk about what those injuries are, how to get over them as quickly as possible, but then most importantly, how to return to exercise without re-injuring your spine. Once you have a low back injury, you're always at a greater risk to re-injuring that, and we want to keep you from doing that. So this deadlift exercise, it used to be primarily done by powerlifters. As it's becoming more recognized as a functional and a core exercise, it's becoming more popular. More personal trainers are using this exercise in their routines with their clients. It can be a wonderful thing again, but the problem is if it's not done correctly. For example, a lot of people are either too rounded in their spine, that is going to increase the risk for injury, or people extend their low back and they extend their neck too much, like this photo here, and that also will increase the risk for injury. I've heard it said before that a proper deadlift is done in between two really bad positions, and that's essentially true. You need to find a neutral spine, which we'll go over a little bit later. Right now, let's talk about what do you do if you've already injured your spine. Within the first 24 to 48 hours, most people are going to find that resting it, icing it, and using anti-inflammatories are going to be the best. Now when I say rest, that doesn't mean bed rest, lay around and don't do anything. There are some gentle stretches that can be done. In yoga, some of these stretches are called the cat-camel stretch. You've got hip flexor stretches, child pose stretches, anything that feels relieving. If you can do the stretch and it seems to take some of the pain or discomfort away and it lasts even after the stretch, it's probably a good stretch for you. If you don't notice any improvement within 3 to 4 days, I would highly recommend seeing a spinal health specialist. You want somebody who can diagnose what the pain is and properly treat it. So for example, some of the common injuries, it can be, you can injure the discs, you can injure the small joints in the back of the spine, you can injure the muscles, kind of get a muscle strain, and each of those are going to be treated differently. So for example, you see this patient here that I had, he injured his disc doing deadlifts. He was one of those where he was too rounded or too flexed. He was not improving. I think he had at least a couple of weeks where the pain just was not getting any better. We did about 4 sessions of this decompression. And I did some other treatments too, but primarily the thing that was most relieving is this decompression that you see here. It's just opening up the disc space, taking that pressure off and allowing blood flow to get into those discs so that it can heal a little bit more properly. If it is a joint injury, or if that facet joint that I talked about before, that gets locked up or jammed up, just some traditional chiropractic adjusting, realigning the spine usually seems to be very beneficial. And finally, just realigning the rest of the spine, realigning the thoracic spine, realigning the neck. That is going to help everything heal faster, but it's also going to help put the spine in a better position so that it's less likely to re-injure your spine or your low back. All right, the most important part of this video is to try to understand how to not injure yourself again when you resume the deadlift. In order to do that, you want to be able to do a proper hip hinge. This is the functional movement anybody should be able to do before they do a deadlift or a kettlebell swing. And it's essentially just getting your hips back. A lot of people have a hard time doing this. You're almost going to feel as if a lot of weight is on your heels. Your toes almost might want to come up when you first start doing this. You'll notice I'm getting the hips and the butt way back. Then the knees can start to bend. You'll notice that my body comes forward, but I'm not arching my back in either direction. I'm staying neutral. Which brings me to this. A lot of people, when they start out, will use a dowel, and you want to have a point of contact on your head, your mid-back, and the top part of your sacrum. And you can practice coming back. I'm bringing the butt way back, bending mostly at the hips, but you'll notice my head is not arching up or down. My spine is not rounding or arching. I'm staying very neutral as I do that. So that is called a hip hinge, and that is very important to be able to do that maneuver when you start to resume the deadlift. If you're having a hard time with that, again, contact a spinal health specialist or work with a personal trainer and they can get you doing those properly. If you have any questions, if you want more information, we are here to help. We would love to hear from you. Thank you for watching, and I hope you got something out of this video.